Hello everyone, I am Dr. Vyshnavi and I hope all of you are able to see me and listen to me. If you are, kindly give me a confirmation in the chat box. I hope the relay is fine. Thank you Dr. Surya and Tushar for confirmation. Good evening everyone. So today the discussion is going to be on head and neck MCQs, and we have an open house on the Unacademy app where all of you can log in and discuss with me, or if you have any doubts, or we can have a quick discussion. So on Unacademy open house we can have a random chat, a quick discussion, clearance of doubts and everything. That will be at the end of this session. So link of the open house is given in the description below, so you can click on the link and join to the open house. That is after this class. So here today I am going to discuss head and neck MCQ. So till I have more learners joining in, quickly let me tell you what we have. So on Unacademy we have on 19th of Feb all India mock test, and this mock test is going to be at 9 AM in the morning. So since there will be a lot of participation from many students all across India, you will have a good real-time analysis of where you stand, even in terms of comparison or otherwise where you stand in terms of your preparation and what you need to improve. Since the exam date has got postponed, it is always good to have a reality check and understand where you stand today so that you can improve yourself better to get there into a better ranking zone. So on Unacademy we have plus subscription where you get live classes, recorded classes. You can study on the device of your choice, and in real time you have these classes, so it helps you solve your doubts instantly. You can have Unacademy and Prep Ladder together. We are proud of our toppers who did very well in the examinations. On Unacademy app we have a special class feature where the student can raise the hand and talk to the educator directly. And we have upcoming batch courses, a 1-month batch course for those students who are appearing for the examination now. Since the examination has got delayed, a 1-month quick revision course through help of MCQs, all the 19 subjects will be a good boost of your revision and it will help you keep you on track. And FMG examination preparation is a 4-month course where we have 19 subjects in-depth coverage. And image based session batch is also there, and ultra fast revision batch is also there. We have an integrated system wise batch also coming up. So those interested can use the code ENT10 or ENT Live to get a 10% off. So let's begin with the MCQs. Recurrent laryngeal nerve has a close relation to superior thyroid artery, middle thyroid vein, inferior thyroid artery, inferior parathyroid. So answer in the chat box whatever you think is the right answer. So Surya Tejasvi says C, and also Staphylococcus. What about others? All those who are online can take a call. So we very well know that the recurrent laryngeal nerves enters the tracheoesophageal groove, and from the tracheoesophageal groove it goes from below to enter the larynx. So when it is entering the larynx below at the level of cricothyroid joint, the artery that is in very close proximity is the inferior thyroid artery. So the inferior thyroid artery is in very close proximity with the recurrent laryngeal nerve, whereas superior thyroid artery is in a very close proximity to the superior laryngeal nerve. Let's go to the next question. A 15-year-old child with a rheumatic heart disease is having hoarseness of voice. Mark the nerve that is involved in the diagram shown below. Is it option A? Is it option B? Is it option C? Or is it option D? So they're telling you that there is a patient with rheumatic heart disease having hoarseness of voice. Which nerve is involved? Anjana is saying C. Was that for the previous question, Anjana? Okay, you can't see. Okay, just a second. Let me just change the image, or let me just change the position of the diagram. Now I hope it is visible to all of you. Now are you able to see the image? So I see option B by Dr. Peru. Dr. Surya Tejasvi says C. What about others? Okay, so we know that both the recurrent laryngeal nerves are given from the vagus nerve. So both A and D are vagus nerve. Now how do we know right and left? Right recurrent laryngeal nerve is given at the level of subclavian artery, whereas the left recurrent laryngeal nerve is given at the level of arch of aorta. Now that you know this is the arch of aorta, the nerve that is given off here is the left recurrent laryngeal nerve, and since this you know this is the subclavian artery, the nerve given off here is the right recurrent laryngeal nerve. Now when we talk of a rheumatic heart disease, heart or any mediastinal pathology will affect the left recurrent laryngeal nerve. So we know that since option B is coming at the level of arch of aorta, the answer is B. So let's go to the next question, which is a 60-year-old smoker presents with a history of weight loss and a thyroid swelling which is hard in consistency. Surgery was performed after nerve B and nerve D shown in the diagram got involved. All are true about the resultant condition except most common symptom is dyspnea and stridor. Most common cause is neuritis and thyroid surgery. Kashima's operation with carbon dioxide laser is done. Askew position of the vocal cord. So which amongst the following statements is absolutely wrong? So I'm waiting for your answers in the chat box. So I'm waiting for your answers. Please reply quickly so that we can proceed with the more questions ahead. So I don't see any answers coming. I think there is some delay or a lag from my end or your end. I don't know, because of which I don't see the answers. So let me just go directly into the solution for this question. So when they have told you that there is a thyroid swelling and the thyroid swelling is hard in consistency, the commonest diagnosis that should occur to you is it should be a probable thyroid malignancy. So if there is a thyroid malignancy and the surgery was performed, there is a very high likelihood that the recurrent laryngeal nerves can be involved. Now here they have also mentioned nerve B and nerve D are injured, which means that there is a bilateral recurrent laryngeal nerve injury which can cause bilateral recurrent laryngeal nerve palsy. So if there is a bilateral recurrent laryngeal nerve palsy, what can happen if bilateral recurrent laryngeal nerve is paralyzed? The vocal cords come to lie in a midline position, and now that the vocal cords are in midline position, there is no space for air to go in, resulting in dyspnea and stridor. So dyspnea and stridor is true statement. Can it occur commonly after neuritis and thyroid surgery? Yes, that is the commonest cause. Now what is Kashima's operation if one arytenoid and posterior 2/3 of the vocal cord is removed? That surgery is called as Kashima's operation. So it is posterior 2/3 of the vocal cord plus one arytenoid if they are removed, thus creating a space for air to go inside. That operation is called as Kashima's operation. That is also absolutely true, and it is done with laser, it can be done with debrider, it can be done with co-ablator. But do you see askew position? No. Askew position is seen in unilateral superior laryngeal nerve palsy. So when there is a unilateral superior laryngeal nerve palsy, paralyzed cord is in abducted position, normal cord is in intermediate position. So this position is called as askew position of the vocal cord. So askew position is seen in unilateral superior laryngeal nerve palsy, not in bilateral recurrent laryngeal nerve palsy. So let's go to the next question. What is the triangle shown in the figure known as? Is it Joel's triangle? Is it Baer's triangle? Is it Laurie's triangle? Or is it Berry's triangle? Again, I'll wait for a minute to get response from all of you, and then I will explain the answer. Okay, so Dr. Peru says B. What about others? B also says B. Okay, so there are various triangles associated with the recurrent laryngeal nerve. All these three triangles, Baer's triangle, Laurie's triangle and Simon's triangle, these three triangles are associated with recurrent laryngeal nerve. What do they have in common? They have common carotid artery, recurrent laryngeal nerve in the common. So in all the three, whether it is Baer's triangle, whether it is Laurie's triangle or whether it is Simon's triangle, you will have the recurrent laryngeal nerve and the common carotid artery. Superiorly, if the boundary is formed by inferior thyroid artery, so artery forms the superior boundary of Baer's triangle. Now, if you have the same common carotid artery, recurrent laryngeal nerve and superiorly instead of the inferior thyroid artery, if you have the lower pole of thyroid, you will call this triangle lower LO, you will call this as Laurie's triangle. Now, if you have the same common carotid artery, recurrent laryngeal nerve entering into the tracheoesophageal groove, and superiorly if you have the cricothyroid muscle, then you call this triangle as Simon's triangle. So all the three, whether Simon's, Laurie's or Baer's, all the three will have common carotid artery and recurrent laryngeal nerve in a common thing. Superior boundary just changes. So if it is the artery A to B, so artery forms the superior boundary of the Baer's triangle, LO lower pole forms, it is Laurie's triangle, and if it is muscle, then it is your Simon's triangle. So this is how you are going to identify the triangle. So the answer is Baer's triangle. The neck is divided into anterior and posterior triangle using which muscle as a landmark? Trapezius, sternohyoid, scalenus anterior, sternocleidomastoid and anterior belly of digastric. This is a very simple question. Okay, so Abhi says D. What about others? Okay, so Peru Anjana also say D. Yes, so that's the correct answer. The neck is divided into anterior and posterior triangle by the sternocleidomastoid muscle. So you can see this is your sternocleidomastoid muscle. This sternocleidomastoid muscle divides the neck into an anterior triangle and posterior triangle. Anterior triangle is bounded medially by the midline, superiorly by the lower border of the mandible and posteriorly by anterior border of sternocleidomastoid. So midline, mandible and anterior boundary of sternocleidomastoid. So this triangle is called as anterior triangle. From the posterior border of sternocleidomastoid, anterior boundary of the trapezius and the middle third of the clavicle, you would call this triangle as a posterior triangle. Now anterior triangle is further subdivided into submental triangle, submandibular triangle, you have the muscular triangle, and you have the carotid triangle. Now how is it divided? Let us see. So you have the hyoid bone here. So medially midline, inferiorly hyoid, and posteriorly if you have the anterior belly of digastric. So this muscle is your anterior belly of digastric. This muscle here is your posterior belly of digastric. So between the anterior belly of digastric, medially midline, and hyoid inferiorly lies your submental triangle. Between anterior and posterior belly of digastric and superiorly the lower border of mandible, you have the submandibular triangle. Now this muscle here is your superior belly of omohyoid, and this muscle going here is your inferior belly of omohyoid. Now medially midline, superiorly hyoid, posterior-superiorly if you have the posterior belly of superior belly of omohyoid, and posterior-inferiorly if you have the lower border of sternocleidomastoid, you will call this as your muscular triangle. Then if you have posterior belly of digastric antero-superiorly, if you have superior belly of omohyoid posterior-inferiorly, and if you have the anterior boundary of your sternocleidomastoid, you would call this triangle as carotid triangle. So anterior triangle is further subdivided into submental, submandibular, carotid triangle, and muscular triangle. Posterior triangle is further subdivided by this muscle. This muscle is your inferior belly of omohyoid into a occipital triangle and a subclavian triangle. So posterior triangle is subdivided into occipital triangle and a subclavian triangle. So this is in brief description of the division of the triangles of your neck. Now let's go to the MCQs. The dash triangle lies between the anterior belly of digastric muscles, occipital, posterior, muscular triangle, submental triangle, submandibular triangle. So I am waiting for your answers. We've just seen between anterior belly of digastric lies which triangle. So this is your anterior belly of digastric. Opposite side you have another anterior belly of digastric. So which triangle lies between the anterior belly of digastric? Yes, it is the submental triangle that is between the anterior belly of digastric. Between the anterior belly of digastric and your posterior belly of digastric lies your submandibular triangle. So between the two anterior bellies you have the submental triangle. The posterior triangle is divided into two triangles by which muscle? I have already explained this to you. Is it the digastric? Is it the trapezius? Is it the omohyoid, mylohyoid, or the sternohyoid? I have told you. Yes, the posterior triangle is divided by the inferior belly of omohyoid into two triangles. You have an occipital triangle above and a subclavian triangle below. Which muscle retracts the mandible? Masseter, temporalis, buccinator, medial pterygoid, lateral pterygoid. Okay, so since I haven't described to you about the muscles which are helpful for mastication, so quickly first let me describe you the functions of the muscles and then let me take you to the MCQ. So when we come to the pterygoids, whether it is medial pterygoid or lateral pterygoid, the function of this is to elevate and protract the mandible. So when you want to elevate and protract, that is your pterygoids. Digastric is for elevation and depression of the mandible. Masseter only elevates the mandible, whereas temporalis elevates and retracts the mandible. So all the muscles of mastication are responsible for elevation. What you have to understand is which muscle is responsible for protraction. As it starts with P, it is the pterygoid. So the pterygoids are responsible for protraction. Then digastric, D for D again, digastric is responsible for depressing the mandible. Masseter has only elevation function. Then we have temporalis. This temporalis is responsible for retraction of the mandible. So now go back to the question quickly. The muscle that retracts the mandible specifically is temporalis. So now did you get clearly the function of each of the muscles, masticator's muscles? Yes. Which one of the following muscles forms the diaphragm of the oral cavity? Digastric, mylohyoid, geniohyoid, stylohyoid, genioglossus. Which is called as the diaphragm of the floor of the mouth? Okay, Anjana says B. What about others? So you can see here, this is a muscle that is lying here. This muscle is nothing but your mylohyoid muscle. This mylohyoid muscle is called as the diaphragm of the floor of the mouth. So it is the mylohyoid muscle which is called as the diaphragm of the oral cavity. Now the next question, special sensation from the tip of the tongue is carried via which nerve? So I'll tell you specific meaning, taste. Special sensation is of taste from the tip of the tongue is carried via vagus, lingual nerve, hypoglossal nerve, chorda tympani nerve or the glossopharyngeal nerve. Okay, Surya Tejasvi says D. What about others? Yes, it is your chorda tympani nerve. So the special sensation from the tip of the tongue is carried via the chorda tympani nerve. The palatine tonsil is normally found within what vallecula, oropharynx, pyriform fossa, nasopharynx or laryngopharynx? Yes, so the palatine tonsils are also called as fascial tonsils. They are located within the oropharynx. Now, before we proceed to more clinical based questions, I would invite you all to join the open house which I am starting right now in 5 minutes on Unacademy app. So I will see the rest of the questions are being solved there. So here I would just like to say you bye bye and take a sign off from you. All of you can download the app, and those who already have the app can update the app, and there will be an open house session. So you can just log in into that in the next 5 minutes. I will be online there, and it's a free session. It's an open house for everyone. So everyone can get together and discuss. You can talk to me. If you are a user who is already on an academy or prep ladder or having an iconic subscription, you get an opportunity to talk, whilst others can get an opportunity to react. So see you all in the open house. Until then, take care and bye bye.